Good morning, everyone. Is there a correlation between cervical spine and TMD, a musculoskeletal disorder? Well, chiropractic care can help, and we are going to showcase success outcomes in our session today. I'm Amita from Nourish Doc, a global platform for natural and holistic therapies. Presenting this complicated topic, we have Dr. Bolden Harris, one of the top chiropractors from Round Rock, Texas. Dr. Harris has helped thousands of adjustments for both adults and children to help them live a more healthy and balanced life. Welcome, Dr. Harris.
Hey, good morning. Thank you for having me.
Great. Let's get started. Let's begin with the correlation between cervical spine and TMD.
Well, when you look at TMJD or TMD, it's kind of interchangeably called two different things, but it's temporomandibular joint disorder. There's a very strong correlation between what's happening with the cervical spine and also with the jaw, that joint, that TMJ joint. And the reason is because biomechanically, you're not able to open your jaw properly if the patient has forward head posture. And if you look at anybody out there, you'll see that almost everybody has forward head posture because we're so used to texting on our phones, we're looking down at our laptop or computer. We spend more of our day in flexion than we do in extension. Our muscles also get fatigued because we live fairly sedentary lifestyles. And just looking at the posture of our chairs, our cars, and couches and beds and that sort of thing, it leads to this forward head posture. And as your head comes forward, it changes the mechanics of the jaw. There's also a number of different traumas and injuries that we experience over a lifetime, whether it's car accidents, sports injuries, slips and falls, domestic abuse, that sort of thing. These lead to the jaw injuries that we have, whether they're acute or chronic injuries that we suffer. It not only can affect the jaw, but it also affects the neck. And so the two go hand in hand, and all the oral care journals, they suggest having a proper head and neck exam for patients that have TMD. Now, obviously, dentists, orthodontists, oral surgeons, they're not trained in how to do proper head and neck exams. That's really our arena. And so we work really well with local oral care providers to help provide relief for patients that are suffering from popping and clicking and pain, lockjaw, the bruxism that they're experiencing in their jaw for a variety of different reasons.
So let's talk about a little bit on the neuromuscular connection. I think you have a very slide over here that tries to explain a little bit more in detail.
Yeah, so there's this intricate balance between the mechanics and the neurology, the soft tissue, the joints, and they all have to work in conjunction together. So when we look at the jaw, the TMJ joint, your bite is affected. And so sometimes patients, they'll have an underbite or overbite. And oftentimes we'll have patients that come in, they've had surgery, they've broken the jaw, and they've had surgery to try to repair that. And so if your bite is not correct, every time you take a bite, it's going to irritate and damage the cartilage in that joint. And it's going to lead to tightness and tension in the masseter and the lateral pterygoid muscles, the temporalis muscles, and eventually start leading to things like headaches and neck pain. And so it's kind of the chicken or the egg. Did the jaw problem come from the jaw, or does it come from the neck? But that TMJ joint is very much affected by your bite. And so that's one thing that dentists are great at, is evaluating your bite and making sure that are the facets even, is the jaw off out of alignment and that sort of thing, and really working with like an appliance to try to help align that. Where we come into play is with the other areas. We're looking at the muscles. So we do a rehab program in our office where we're doing soft tissue work with patients, and we'll work on stretching the muscles that attach to the jaw that help it move properly. And so we want to not only work on the soft tissue, breaking down scar tissue, adhesions, we want to stretch the muscles, we want to strengthen. We also want to improve nerve flow, which is the next section there, is improving the nerve flow to those muscles so that they can fire properly. So that means proper alignment of the jaw. It may require an adjustment of the jaw or adjustment of the spine and the nerves that supply the nerve supply to the muscles and the skull and into the jaw. And so chiropractic, a lot of people think that we're back pain or neck pain doctors, but really we're nerve doctors. And so when we're evaluating the spine, we want to find where those irritated nerves are that are preventing the muscles and the joints from working the way that they're supposed to. So again, a lot of that has to do with your posture. And so when we talk about forward head posture, somebody leans forward, it's going to cause the jaw to shift forward or backwards, depending on the position of your spine. And then also improving airways, because if you have had a facial trauma, it's going to include the airways, or maybe you have a deviated septum. My sister actually does a technique called craniofacial release, and they work really great together for patients that have difficulty breathing to help improve those airways. It's a totally separate topic, but those all work in conjunction together. And so when we have patients who come in our office, we evaluate them for these problems, and we're able to have very successful outcomes because we're addressing all of the causes of the problems instead of just treating the symptoms. And so I see this next slide kind of parlays into more of the nerve system, where we're talking about the sympathetic nerve system, the parasympathetic. So basically your fight or flight systems. And so part of the sympathetic, that's designed to speed your body up. The parasympathetic is designed to slow your body down. And when these are out of balance, when you're in that fight or flight, you're more in the stress, which is how we tend to be, then your muscles are going to be more tense because you're ready to fight, you're ready to run. And so when we have that tension, that's what causes a lot of the problems that you experience in the jaw where you're clenching. And we'll find a lot of those patients are grinding at night. One of the most common exacerbations that we find for TMJD is stress. And so we'll find that people are stressed and they're tight and they're clenching all the time. They're grinding at night. They're wearing down those facets and causing further problems. So adjustments, they're proven to increase proprioceptive input to the brain, which is going to decrease nociceptive output to the body. And so it's going to help relax the muscles, turn on parasympathetics, decrease sympathetics, and help the body to create more balance. And of course, all of that reduces cortisol, epinephrine release, insulin release. It has an impact on other organs in the body, which is how chiropractic is able to help with things like allergies and digestive issues and hormone problems, but also the chronic illnesses that we experience. So I know this presentation is more about TMD, but there's so many different ways that chiropractic is able to benefit a patient by normalizing function in the body. Now, this is a great poster. This is from Dave Mager at Game Face. This is a great poster I love sharing with patients because people think that they have to have pain when they come in to see the doctor. But most of our TMJ patients, they don't really so much have pain. Oftentimes they come in because they have the popping and the clicking, and often they're very self-conscious because they go out to a dinner party or they're hanging out with friends or on a date. They're with their family and they're eating and their jaw is popping all the time, and they're very self-conscious about it. And so it doesn't always require pain. And so this poster here is great. You'll see down at the bottom, the little red circle, this is a cross section of a nerve. And so it shows what the nerve fibers actually do. And so a very small portion, about 10% of those nerve fibers transmit afferent sensory input to the brain that tells it that there's pain. And so the vast majority of your nerve doesn't have anything to do with pain. So if we just based our symptoms, if we based our problem on our symptoms that we had, we'd be wrong about 90% of the time, because symptoms come and go, they travel to different parts of the body, they change in sensation over time. So we don't like to base it on pain. However, half of that nerve controls the muscles. So the muscles are very important to helping us understand mechanically what's going on with the spine. So your muscles may be really tight and tense, like in the case of TMJD, or the muscles are very weak, so you're not able to maintain a normal, healthy cervical posture. And then the other 40% of those nerves controls the autonomic. That's all the automatic systems in the body, the hormone production, your immune system, all those things that you don't have to really think about. So the majority of your nerves don't have anything to do with pain, which is why we base our results on our objective findings. Is in our office, we do a thorough spinal exam, we do a thorough TMJD exam, we do digital x-rays, we do motion studies. So and then we also specialize in a technique that's called Gonstead. It's one of the most specific techniques that's out there. And so we're putting all this information together to be able to help patients know confidently that we know what's causing their problem and that we're able to correct it. And so again, we talk about the TMJD or TMD pain cycle. So it talks about any traumatic, it could be psychological, like you're stressed, you're going through divorce, you're failing your class, your kids are in trouble, that sort of thing. It could be a mechanical stimulant. All of these traumas, in chiropractic, we talk a lot about the 3 T's, traumas, thoughts, and toxins. All of these stresses, not only do they have an impact on the spine, but they can certainly impact the jaw. And so this leads to muscle spasm. That muscle spasm is going to restrict the blood flow, and that's going to cause chemical changes, lactic acid. You get those trigger points, the knots, that build up in those muscles, and they no longer function properly, which leads to even more spasms and involuntary contraction, which eventually leads to pain. And so you end up with this cycle. And then when you have the pain, now you have more stress. So it leads to this vicious cycle where the jaw just continues to break down and that cartilage will wear down. And unlike the intervertebral disc, which can regenerate and can actually rebuild and repair, the disc in the jaw we find is not very receptive to repair. And so unfortunately, if it gets bad enough, if that disc is completely worn out, the only solution is reconstructive surgery, which nobody really wants to go through that. So if we can address these problems early before patients start to have pain and start this pain cycle, the outcomes are a lot more effective. So when we study the anatomy of the neck, you can see there's quite an intricate number of muscles that are attached to your neck and your jaw. So I always like to do this with patients when we're doing the report of findings. I like to show them mechanically what's happening with their jaw. And so I always use this model here. I've got the TMJ model. And so when you open your jaw and you're in a neutral position, and you can go ahead and try this, Amita, yourself or anybody who's watching, but
All right.
go ahead and just sit up straight. And then I want you to just put your hands on your jaw. Okay. And then go ahead and open your jaw and just feel how it moves. Just open it 2 or 3 times. And you may notice what's interesting is it may shift to one side, because if the muscles are tight on one side, it's going to pull the jaw to that side. It's not something that you notice on a regular basis because most people don't have pain or symptoms there. But when you feel it, you may notice that it shifts to one side, or maybe it shifts to one side or back, or sometimes it goes clunk, clunk. And so these tell us mechanically what's wrong with the jaw. But this is when you're doing it in a neutral position. So I always like to have patients bend their head forward, mimicking forward head posture. And when you bend your head forward, what happens is your jaw actually juts forward. And so if you open now, you'll notice that it feels different when you open your jaw because it's sliding forward. And then we have you bring your head back into extension and you open your jaw a few times. And you'll notice that now your jaw slides backwards. So when you open it, it's going to shift back. So the position of your head plays a very important role in how well your jaw is opening. So if you have somebody who is talking on a cell phone and they're holding their phone, or they're holding their kids, or they're typing, or they're doing a repetitive motion, maybe a pitcher in baseball, all of these muscles that are in your neck, they attach to the skull. Some of them attach to the jaw, and it can cause this cascade of tightness and tension that lead to the tightness that you experience in your jaw, wearing down that cartilage. So we have to address the neck, and in our office, we do, again, a motion x-ray study, so we can pinpoint which bones are the ones that are out of alignment, so which ones are causing the problem, and then we know which ones we're correcting. So again, everything that we do in our office is very objective, so we're able to measure that over time. And with Gon said, we use motion x-ray studies, we use a nervoscope, which is a device that tells us where the pressure is coming from in the spine, so we know which segment and which level needs to be focused on, and if we're correcting and if we're making progress. And then we do a motion study at the end of their care plan, so we can assess and reevaluate and show patients, yes, we're fixing the cause of the problem. We're not just masking pain and symptoms. So TMD, again, sometimes it's called TMJD. They're kind of interchangeable, but it's an imbalance in the jaw. And generally speaking, people think of it as jaw pain, but it can be any kind of aberrant function and motion in that jaw. So it may be the popping, the clicking, the bruxism, but just an abnormal movement in that jaw. And if it's not addressed, eventually it can lead to some serious health problems. And so the next slide we talk about, we've already addressed some of those exacerbating factors, but stress is one of the main ones. In this time of year, or this time in our lives, just with the pandemic, I mean, there's tremendous amounts of stress. People have lost their jobs. They don't know what to do with their kids, and they're worried about the future of the country. They're worried about getting sick. And so there's a tremendous amount of stress that patients are under right now. And so we're starting to see more of our patients that maybe they didn't have pain or symptoms in the past are starting to notice that they're having more issues with their jaw. It's locking, it's not moving the way that they want to. So stress is one of the main factors, and also that myofascial irritation, the masseters, the lateral pterygoids, and we'll do some internal stretching and work on the muscles inside and the back of the jaw, the temporalis, the digastric muscles, and we work on stretching all of these muscles so that we can restore normal range of motion. Normally, you should be able to move your jaw from side to side about 10 millimeters and open about 40. I'd say on average, patients that come in with TMD issues, they're probably opening about 5 to 7 millimeters from side to side and about 20 to 25 with their jaw expansion. So most people, they're just not able to open their jaw wide enough. And as a result, they're not able to do things like eat foods. They're not able to have intimacy with their partners. It gets very tired when they're talking. So people that are maybe in sales, like a realtor or somebody who's selling cars and that sort of thing, they have a hard time. Teachers, because they're constantly talking, and eventually it leads to a lot of problems and pain in their jaw. Of course, trauma. We also take care of a lot of car accident cases, and we have attorneys that will refer patients to us because when they get in that car accident, the airbag goes off. It may hit them in the face. They end up having jaw problems or pain after that. Again, my sister does the cranial facial release. They may have some damage to their facial bones as well. But whiplash injuries, not only does that affect the jaw directly, but it also causes problems in the neck. The dental problems, bruxism, poorly fitting dentures, the malocclusion, again, people that have had some type of dental injury. We've had quite a few patients as well over the years that come in after having dental work. Maybe they've had a root canal, they've had an extraction, maybe they've had orthodontist. Jovan Orthodontist is fantastic. They do great work, and they usually will send a lot of their patients to us after they've had their braces off and they've got their retainer, and they're starting to notice that things are shifting, and so they'll send them over to us to work on them. Sometimes we'll have dentists that will send patients in because they want to get an appliance measured. So they'll have us work with their jaw to get things back in alignment before they provide an appliance for them. So we work really great with dentists. There's quite a few in the area that we've got a great relationship with, and they've sent us patients and we've had great results. Also, some of these inflammatory diseases, maybe not as well known, but you can have all types of inflammation. A lot of that comes from our diet and some of the foods that we eat, but also repetitive trauma. So these are probably the most common contributing factors that we see is going to be your macro traumas and micro traumas that we've listed here. Now, again, we've talked about what's that?
No, I was just going to say this is a lot of great information for a lot of people. Okay. So maybe we switch a little bit and you can talk about the research, right? Different research and science. Yeah.
So there's, and if anybody wants some of the research articles that I've got, we can certainly share that. Shoot me an email or shoot me an email after. But the Journal of Applied Oral Science talks about cervical spine disorders or perpetuating factors to TMD. And again, we talked about that because if you have degeneration in your spine, it's pinching the nerves, maybe some of those cranial nerves are being affected. It certainly is going to play a role into why the muscles in the head and the neck, the occipital muscles, those temporalis muscles, why they're getting tight and tense. It can lead to cervicogenic headaches, those or migraines, and those can cause jaw problems as well. But the research again shows a strong correlation between head and neck problems, not necessarily symptoms. And that's where I think people think they have to have neck pain first, but we'll find a lot of head and neck mechanical problems objectively, even though the patient doesn't have symptoms. They can have severe degeneration, severe forward head posture that all leads to this. This next research article is talking about internal derangement of the TMJ, significantly associated with cervical spine disorder. So just a very strong correlation that when you have damage, degeneration in the neck, you're going to have a strong correlation with jaw problems. And again, we don't base it on subjective alone because we do find a lot of objective problems, even though the patients weren't aware. So they always recommend have an examination of the spine, even without any type of cervical complaints. JMPT, again, we just talked about this earlier. The position of the jaw, head and neck are intricately linked. And so a lot of those symptoms, as you develop more forward head posture, is going to increase problems with the jaw. So even if we only address the forward head posture with patients, that's going to help reduce a lot of the TMJ issues because it's going to help restore normal mechanics. As chiropractors, we adjust the spine, but some of us have been trained in how to properly adjust the jaw. A lot of chiropractors, they don't really want to mess with it because you can make things worse if you don't know what you're doing. But that's, again, why we take our x-rays. It's why we've done advanced training on this to make sure that we know exactly what we're doing and we're able to help with these patients. So treatment and prevention, we talk about taking a comprehensive history There are some offices that are more wellness based, so they don't do as comprehensive a history because they're more focused on just getting things back in alignment, helping you to feel better that way. But when it comes to patients coming in with serious problems or more complex and complicated issues, it's important to have that history because we'll find things that maybe somebody else missed because they didn't dig as deep as we do. But we do a comprehensive history. We also do a posture evaluation with all of our patients. So we'll evaluate your posture and we measure that over time to assess what your posture looks like, because your posture is like the window to your spine. When we see your posture changing, we know that your spine is changing, and without having to take a new x-ray, we can assess that over time. We also do measure autonomic balance, so basically how well your body's functioning using our nervoscope. We do pre and post x-ray studies. So again, we're very objective in our approach and how we assess that. We do jaw measurements along the way. So again, we're doing lateral deviation, we're doing jaw expansion, and then we're also looking for the mechanical movement of the jaw over time. And so we'll do pre and post. We do those about once a month. And then once we figure out what the cause of the problem is, our corrective approach is to incorporate chiropractic. Oftentimes these patients have a straight neck or a military neck, or even sometimes a reverse cervical curve. So we'll apply a cervical orthotic that's very gentle in nature, just using gravity. It's not very aggressive, but that's designed to help put that curve back into the neck and get that pressure off of the spinal cord. And then we do home exercises. We do rehab here in the office. We go over all of the exercises that our patients need to do. So we review them with them. We have a personal trainer here that's going to go over all those exercises. We have an app where all of your exercise prescriptions are stored. So when patients come in, we do their exam. We know exactly what's wrong. We work on addressing their posture and then flexibility and mobility, doing neuromuscular re-education exercise to retrain the body. And then we will focus on strengthening and hardening and strengthening your core and your posture. So we go over all of those exercises to ensure that you're doing those properly. And then you have those exercises stored in an app where you can watch videos and pictures to ensure that you're doing them properly and to remind you of which ones you're supposed to be doing at each time. We also have a vibration plate in our office, which is very helpful at regenerating and repairing muscle and damaged tissue. We have our in-office rehab program, again, that our trainer does. We also have a massage therapist in our office, and our massage therapist is able to do Swedish, myofascial, deep tissue types of massage. We're breaking up scar tissue and adhesion. So it's not spa type massage where you're just going in there to relax and be put to sleep. It's actually functional and corrective in nature. So these are things that are all billable to insurance. I know sometimes people have questions, are these the type of things that are covered? But yeah, absolutely, because we have a diagnosis and we have a therapeutic approach to addressing these problems. They're all things that can be billed to insurance as well versus more of a spa type massage. So with chiropractic, again, we use specific adjustments. The more specific, the better. And so with Gonstead, we use the 5-point system. We use the instrumentation visualization. We use our x-ray analysis, static palpation, motion palpation, and incorporate all of that with your clinical history to be very specific on every single visit. So we're never guessing. We always know exactly where we need to focus. And then doing advanced training with Dr. Alex Vidan. He was the team chiropractor for the St. Louis Rams cheerleaders, the St. Louis Cardinals, and he's been a mentor of mine for years that's helped guide me into learning what are the best methods for approaching and addressing and correcting the jaw. And so it's been a joy to work with him and to learn from him. But all of this creates stability, not only in the spine, so it's going to help with a variety of other problems that patients may come in with, like headaches and ringing in your ears and facial tic douloureux, facial palsy, those types of things. We see patients come in with a lot of these issues that have tried everything under the sun, different creams, medications, and they haven't been able to get benefit or help there. And we've been able to help them, but certainly with TMJ issues.
Right. So
here's
these are
a
some
picture of me kind of working with a patient in our practice here. And so when patients come in, the first thing we're going to do is we're going to check their spine. Again, we use an instrument called a nervoscope that allows us to be even more specific. So we're never guessing where we need to focus. And then the picture on the right there is me doing the TMJ work, doing that soft tissue work on patients. All of this takes about 5 to 10 minutes on a typical visit. So it's not something where you have to block out, 30 minutes to an hour every single time. You come in for your adjustment. We're very specific. We get in and we work on finding the cause of the problem and correcting it. And I always love this chart. This is, it shows how the spine works. It's like a circuit breaker. When we have patients that do come in with symptoms, we're often able to trace that back to damaged areas of the spine. In Windsor autopsies, they studied cadavers, and they found that over 90% correlation that with these cadavers that had these organs, they traced those nerves back to the spine, and they had damaged areas of the spine. So when patients come in, it's like we're just working our way down their spine. We're finding the problem areas, we adjust them, and then what's even most important is we're able to recheck that to make sure that we corrected it and that we're working on the right areas and we're fixing the problem. So a normal spine is going to look like this, and I love using this example, but this is what a normal spine looks like. You'll notice that that disc is nice and healthy. Those muscles in the back, they're nice and relaxed. The nerve has plenty of room, but when a bone is out of alignment, and you can see in the model here, when that bone gets out of alignment and it's stuck, it starts squeezing all the fluid out. That's degenerative disc disease. And because it's so unstable, the body will start creating bone spurs to try to fuse it together, and that's degenerative joint disease. Eventually, that disc may even bulge. And when you get that bulge, that's a herniated disc, and now it's pinching that nerve. So when patients come in, one of the things we can do is an orthopedic exam to see if they have any evidence of a space-occupying lesion, herniated disc, Facet syndrome. These are different problems that are more complicated that we're able to detect and decide if we need to refer out for an MRI and further imaging. But it's also great that we have imaging in-house so we can see these problems before we start working with them. One of the landmarks of what we do in our practice is taking an x-ray before we assess a patient, because we have patients that come in, they have extra vertebrae, they have missing vertebrae, they've got stress fractures that never healed, they may have aneurysms, all variety of different types of problems that we wouldn't know without having an x-ray. And so I've got a couple case studies here. I've worked with a number of patients over the years. We've had great results, but this is pretty typical. I had a patient, she'd come in, she had bilateral pain in her jaw for 20 years, and it was exacerbated by stress. She tried over-the-counter prescription medications, manual therapy. She'd been to other chiropractors, massage. So really trying pretty much everything that's out there. She also had headaches, neck pain, and tinnitus, so this ringing in her ears. So when we did her initial exam, what we found was her jaw would only move 3 millimeters to the left. When she first came in, it would only move 5 millimeters to the right, but it opened 45 millimeters. So she had good jaw expansion, but her jaw just wasn't able to move side to side. Her pain level was an 8 out of 10, so quite intense. So after working with her over 3 months, we were able to get that jaw moving from 3 millimeters to 12.4 on the left, 8.8 on the right, and 47 on the jaw expansion, and pain was down to a 1. So that also helped relieve the headaches, the neck pain, and started to decrease the ringing in her ears, all because we were working on and addressing the cause of the problem. The next case study I have is a 14-year-old female. These are a lot of the patients, like I said, we get from Jovan orthodontists. We get a lot of patients that have had these braces. And the reason why this is significant is because children, they're still growing and developing. So their jaw is still growing. And so it's important that we're aligning things so that they don't have these long-term chronic issues with their jaw and the bones developing improperly from being in the wrong position. But this young woman, she was 14. She'd had lockjaw for 6 months, so she wasn't able to open her jaw. You can see in her initial exam, 4 millimeters to the left, 2.8 to the right, and only 18. She was only able to open her jaw halfway as much as a normal person should be able to. There wasn't a lot of pain associated with it. She just wasn't able to open her jaw. So she wasn't able to eat the foods that she wanted to eat. And over time, over 3 months, we were able to get that jaw to at least 10 millimeters laterally and then open it all the way. And all of the pain and the symptoms were subsided. So we're able to work with kids, adults. It doesn't really matter what age. We're able to work with any age group. And the youngest patient I've had is been an hour old, and the oldest patient I've had has been 97. So we do see Medicare patients all the time, and we have a variety of different types of patients that we see. This is the posture screen app that is really cool that we use. And so we'll take a picture of a patient's posture, and we're able to assess what their posture looks like. And based on what their posture looks like and what we've evaluated during the exam, we can come up with a custom exercise prescription form using the My Rehab Connection app. So we're trying to be very high tech, and have apps and use software that makes it easier for patients to do these things on the go. We want to see patients as little as possible. So if we can educate them and teach them how to do the things that they need to do outside of the office, they're going to have the best outcomes and they're going to have the best long-term results. Just like a dentist who teaches you to brush and floss your teeth, we want to teach our patients spinal hygiene, things that they can take with them. So they're not always just, okay, I have to keep going to the doctor all the time. We want to teach you how to take better care of yourself.
So you have to be a patient, right, to use this app? I just wanted to, or is it a self-service, like anyone can do it?
Yes. So you have to be a patient because we give an exercise prescription, and obviously we're not able to give a
Okay.
prescription without having an assessment.
Sure, sure.
But we do invite patients to come in, have an assessment, and do an exam. We use the posture screening sometimes when we've done spinal screenings. Obviously, with the pandemic, we're not doing health fairs and events like that right now. But we always encourage patients to come in and have an evaluation, and we can assess them. Um, so our gift today is we're giving away an exam for $49. That includes a consultation, exam, any X-rays that are necessary, and a 30-minute massage. And this is good for anybody that maybe is not watching right now. I don't know how long this will be up, but if you reference this webinar, then we'll certainly honor that first visit for you. But our biggest thing is trying to find out and educate patients about what's causing their problem, because we have patients who come in all the time who they're just frustrated because they've been to a litany of different doctors. They've tried different medications, and they're just frustrated and discouraged because they haven't been able to get any relief or any answers as to what's going on and what's causing the problem. But we've been here for, we've been in practice in this Round Rock area for 6 years. I've been in practice for over 16. Absolutely love what I do and love serving the community. And so we're excited about the growth that we're experiencing and the opportunity to help more people with TMJD or any type of spinal health problems.
Thank you. Thank you so much. And we will share this webinar and focus on some of the Texans, Texas or residents, because since they're close to you. And so right now we are aiming it live for FB Live. I do see some people who are attending in Zoom. We are open for questions. If there are any questions that you would like to ask, we would welcome your questions. It's up to you. But otherwise, I think, you've explained each and every detail, all the issues in a very detailed. My only question was how common is this problem that the TMD that you talked about? Is it a very common problem? You said stress, but stress leads to a lot of other things also, right?
Right.
In our bodies.
It's more common than I think people think. As chiropractors, we kind of get stuck in a box, and people think
Yeah.
neck pain or back pain or car accidents, and so they don't really bring up problems that they don't think we can help with. So we've tried to educate people, but we do find a lot of patients after they see our brochures or flyers or we're doing a talk, they're like, oh, I've got jaw problems, and they never had brought it up. Maybe we've been taking care of them for years, but they never brought up that they were suffering with jaw problems because they thought that's more of a dental issue. And so I would say it's a lot more common than you think. A lot of people don't know what to do for it. A lot of dentists aren't
Sure.
really sure. They'll try an appliance or splint, and so it's one of those things that nobody. It's kind of like fibromyalgia. Nobody really wants to deal with it because it's very hard to treat. But it's because it requires a combination of addressing what's happening in the jaw and in the spine, and then working with
Yeah.
your dental provider as well. And so we've got, like I said, a great relationship with dentists, and I know there's a ton of doctors all over the world that do the same work. And so if somebody is not local, we can certainly work to try to find somebody wherever they are that
Okay.
does essentially the same thing.
But do you offer any online initial consultation at all? Because I would like to give that opportunity for someone who's not living close to you to at least have an initial consultation.
Sure, yeah, we can do that. We work with doxy.me, and we can set up a telehealth consult, and
Okay.
we can answer any questions and try to guide you in the right path and try to help you find a solution. Like I said, I know uh, hundreds, if not thousands, of chiropractors all over the world, and so with the network that I have, we're able to find somebody wherever you live. But we'd be more than happy to sit down and discuss it with you and answer any questions that you may have.
Okay, okay. Well, thank you so much for coming today. For it's a very invaluable it's session, and a lot of details that a lot of people don't know about. Jaw pain. I would think that I would go to a dentist. My first line of defense would be to going to a dentist, not to a chiropractor. But I think a lot of people need a lot of education. So this is great. Anything else you'd like to add before we wrap up?
Well, one thing that we're looking at adding by the end of the year is regenerative medicine. And so we're looking at the options for exploring that with addressing jaw issues. So doing either stem cell injections, hyaluronic acid, and how that may help with people. Because if the jaw gets bad enough, like I said, really the only other option that we've found is reconstructive surgery. And you're talking like scars, and a lot of oral surgeons don't really want to go that route if they can avoid it. So we're looking at exploring that as an option to help some of those patients that are too far gone and we don't feel like we can help, so that we can help them without them having to have surgery. And so we're
Yeah.
excited about bringing that on as the year goes on. But no, I appreciate the opportunity to share what we do. Obviously, you can see we're very passionate about it. We love what we do, and
Yes.
we're just excited about helping people get better and get well.
We have a question, Dr. Harris, actually.
Okay.
This is, I know you're very passionate and each and everything that you described. I myself had no clue. But the question is, besides the symptoms you described, if you feel the pain in the jaw, someone is feeling a pain in the jaw right now, that's what I'm assuming. How can you tell besides the initial, as I can consult with you or a specialist? That's what they're saying. And then they want to know how can they contact you via the initial online diagnosis. You can email us at care@nourishtalk.com and we'll put you in touch with Dr. Harris. Right,
Yeah,
Dr. Harris, you said that you can do online consult, because we would like to have you do online consultations for for our clients or for people who
sure.
have questions. So you can definitely email us at care@nourishtalk.com, and we can we'll work with Dr. Harris and put you in touch with him, and you can do the initial consultation online, and he can guide you like you said earlier, right?
Yeah, we can do that, and we can get something scheduled and block out some time where we can sit down and discuss whatever's going on.
Yeah.
And then what was the first question?
It was the same. I think it's someone who's attending right now live. I think they have this. All right. They're saying that they don't have the pain right now, but they're a little bit worried. So they might be feeling a little bit of some of the symptoms that you have described. That's what I'm assuming. I don't know all the details, but I think someone is saying that they would like to do a consultation because they might be experiencing some of the symptoms that you described. That's what they are saying. And that's what this person is saying.
Right. So yeah, without doing an exam, it's hard to really tell. But if somebody is having pain in their jaw, I mean, it's a pretty telltale sign that there's something that's not working right. I mean, it doesn't obviously hurt unless there's something that's not right. However, it can be complicated because when you're diagnosing health conditions, there's a variety of different things that can be causing that pain. And so it's important to make sure you're doing your due diligence and doing a exam, doing imaging to really find out, is this something that's minor? Is this something that's more moderate? Or is this something that's more severe? Or maybe even something that we need to refer out to the appropriate provider. So it's hard to say that just based on the symptoms alone. Again, that's subjective. And so that's why we would want to do an objective exam. But with the initial consultation, it kind of walks us down the path where we have a better idea of what may be going on. And if it just doesn't make sense, then it might be time and appropriate to say, okay, well, we need to refer out. Otherwise, we would want to do an exam or get you to somebody who can do a proper exam.
Sure. Well, thank you so much for taking the time to come today and educate all of us. I really want to thank you. And
all right, thank you.
Well, we have another one. Sorry. Okay, let me just see. I'm sorry, I was just, all right. So, okay. Every time it happens, I'm ready to wrap up and then somebody would pop up with a question. No, the comment is, I'm happy with your answer.
Okay, awesome.
Awesome. Thank you so much. So thank you so much again. I'm going to wrap up. If there are any more questions, please email us, care@nourishtalk.com. We're happy to refer you to Dr. Harris. Or to all the viewers, please help us spread the word. Please share this session. Dr. Harris is an amazing chiropractor from Texas. Please help us spread the word. Thank you so much for being here. Signing off now. This is Amita. Great. Thank you. Bye-bye.
Bye.